Good evening and thanks for joining us. We begin tonight with fresh mystery over how long COVID-19 may have been circulating before it was first identified. Evidence has emerged in France of a positive case in late December, 4 days before China reported a cluster of cases of pneumonia of unknown cause in Wuhan. The case in France came to light after a hospital there retested frozen blood samples from patients who had pneumonia-like symptoms, and one of those tests came back positive for COVID-19. The World Health Organization is now urging other countries to retest old blood samples, too, from suspicious cases. Redmond Shannon has our top story tonight.
Amarouche Hamar looks back at a video of his time in intensive care in late December. I thought it was the flu, he told French news channel BFM TV. He had a cough, a headache and fever, but recovered and was discharged on December 29th. 2 days later, China first reported cases of pneumonia of an unknown cause. On January 23rd, the epicenter city of Wuhan was locked down. And a day after that, the first case was confirmed in Europe, a French citizen who had been to China. The virus has since killed tens of thousands in Europe. In April, a French hospital decided to retest samples taken from 14 patients who were tested for pneumonia in December and January.
Nous avons eu un qui était positif au Covid-19 le 27 décembre.
Hamar's sample was the only one that tested positive. A backup test confirmed the finding. It potentially changes the entire modelling for how COVID-19 spread, particularly because the 42-year-old hadn't even been to China.
It's not surprising. That's important because given the earliest cases of COVID-19 had symptoms onset already in early December. So it's possible that some of the infected people traveled from Wuhan to other countries at that time.
The World Health Organization now wants other countries to go back and test too.
There's always an opportunity, I think, to sort of go back further if needed to test samples. We haven't actually, as I know it, discussed that as yet, but that is potentially of interest. So we can definitely take a look at that.
Professor Luke O'Neill is working on a treatment for COVID-19. He's reserving judgment until other tests show the virus was outside of China in December.
In science, if you get a really, what you might call a wacky result, you got to wonder what's going on there. Now, one suspicion is the sample was contaminated somehow with a positive sample from January, say.
The results will also be key to the question of the virus's origin, something that has recently become a political football between Beijing and Washington. Redmond Shannon, Global News, London.
Pharmaceutical giant Pfizer has begun human clinical trials of a potential vaccine for COVID-19. It was developed in collaboration with a partner company in Germany, where trials began last month. The first phase involves 300 healthy volunteers, and that could expand to 8,000 people in the second phase. If these trials are successful, Pfizer hopes to have a vaccine ready for emergency use as early as September and possibly wider distribution by the end of the year. There is no guarantee, though. Most human clinical trials fail. Health experts say a reasonable expectation for new vaccines to be developed, tested, and manufactured is about 4 years. Russia is rapidly becoming a COVID-19 hotspot, and there are mysterious cases now of doctors falling from hospital windows. 2 of them were reportedly critical of how underprepared Russia is for COVID-19 and complained about a lack of personal protective equipment. A third doctor who's in serious condition claimed he was forced to work despite testing positive. Moscow has reported more than 10,000 new cases for 3 days in a row.